You have reached the MTA Business Service Center. Calls may be recorded and monitored for quality assurance and training purposes. Please have your BSC ID or federal tax ID and mobile device available, as some inquiries require security verification. For IT,
got a picture of him right behind you, huh?
This is how I could determine. I need to make sure all of my retirees know that when they see him behind me, that this is your videos. These are videos for transit, not New York City retirees. So
we'll be with you as soon as possible.
Your estimated time is about 15 minutes.
Your
Good afternoon. Thank you for calling the PA Customer Management Center. My name. How may I help you?
Yes, Jacqueline, just a second. Okay,
Hello?
Jacqueline. Yes, are you there?
Good afternoon.
Are you there, Jacqueline?
Yes, I am, sir. How are you today?
I'm doing fine, and yourself? Okay, I have a question for you. Do you need any information from me? I use my BSC number, so.
I do have your information in front of me. The protocol is that I verify it on the recorded line.
Okay.
Okay, your first and last name, sir?
Lloyd Archer.
Your telephone number, please? And your email address. Now, I do show you have a ticket open from December.
Yes.
Are you following up on this, or this is a new inquiry?
This is a new inquiry, and after that, I would like to follow up on that ticket.
Okay. Well, I have the ticket open. Let me just take a look. Hold on.
That was actually the second inquiry about that information
That you had today?
yes, about my open enrollment form.
Okay. So a document is that you anticipate, excuse me, an update within 3 to 5 business days. Okay. How can I help you today?
All right, I have a question for you. I know I'm in this Medicare Advantage program. If I decide to opt out, will my spouse or my child still be covered?
I don't think so. Because you're the primary. They're on because of you.
Right. So.
I mean, I can request that in writing if you like.
Yes, please.
Hold on. I don't think you can opt out. You might be able to waive. Let me just check.
I might be able, when you say waive, I could just waive my.
I don't think opt out is an option for retirees. I just want to take a look. Hold on.
Okay.
Okay. Retirees are not eligible to opt out for financial incentives. Their only option would be to waive before waiving coverage. Should have a ticket. Okay. Let's see.
So if I waive my coverage, I would have to go find other coverage or go ask Medicare to pick me up, traditional Medicare to pick me up again.
Correct. You would have to, do what you need to do to get covered, right? If that's reaching out to Medicare, then yes.
Okay. Now.
Okay. So
go ahead.
would you like me to? I'm sorry. Would you like me to prepare the ticket and use the terminology waive to see if your dependents will be affected?
Sure. Yes.
Okay.
Don't waive me. I don't want to be waived. Don't waive. I'm inquiring. That's all.
This is just a question.
Okay.
And I'm going to read it back to you before I submit it, okay? I'd like to know if he decides to waive. Thank you so much for holding.
Yeah.
Okay, so it says, Mr. Arthur would like to know if he decides to waive retiree medical coverage. Please explain how this decision will affect his dependent health benefit. Is that okay?
Yes. Okay. And all right. So
are you there?
Yes, I'm here. Hold on.
Did I lose
I'm here.
you?
No. I'm here. I'm here. My granddaughter was running around. I had to mute her.
I'm sorry.
Damn, I lost my train of thought. Okay, so my union doesn't cover my dental or nothing if I waive? Because I know that the coverage, like the dental and the eyeglasses through the union.
Well, that's something you would have to have a conversation with the union because we don't.
Okay,
We're not hired to administrate your your dental and vision.
okay,
So we wouldn't even have details or terms or conditions on how that plan works.
okay. All right, now, the next question.
Are you okay before we move forward? Are you okay with the ticket information?
Yes. Okay. All right. Just one more question. If I decide, if I waive, because you say I can't opt out, and I decide to come back, do you know how long it would be before I'm accepted back into the plan?
Okay, it says if they waive their coverage, they will be able to re-enroll into the coverage at a later date if any other components of their healthcare benefits will be, if any other component of their health care benefits will be impacted. It just says at a later date. Now, I do know that the consultant with benefits the retiree decides to waive coverage dates to complete the. Okay, so if you do decide to waive the coverage, it's a form you have to complete. I just want to make you aware of the process, so you don't think that this is going to affect, like they're going to waive it because of what the ticket
Right.
says. Okay, so there is a process. Okay, so I do know that it's usually done during open enrollment, right? And open enrollment is usually October, November.
Right. So I couldn't do this if I wanted to until no open enrollment anyway.
Right.
Okay.
I mean, if you want to waive, you can waive at any time, but to re-enroll is normally done during open enrollment, but if you want to shoot your shot, you can do that at any time and let the benefits department make a decision.
Okay. I just want to confirm that if I do waive, can me and my family come back?
Right. So according to the system, it says that you can re-enroll.
Okay.
Right? Because it says before waiving, employees should have a ticket to escalate to the benefits department to ensure that this is what you want to do. So they do want to have a conversation with you. So it's good that the ticket is open, right? And then you will be able to re-enroll at a later date. So this is the only information that I'm provided with. On the good note is the ticket is going to a benefits specialist, and you have an opportunity to address all your questions and concerns if you have additional questions with them directly.
They'll reach out to me, or should I reach out to them?
No, they're going to reach out to you. Let me put some hold. Hold on.
Can this be put out in something?
I'm sorry. Can you repeat that for me, please?
Just a second. Can you put this out in a frequently asked question sheet, if possible?
What, your response? Would you like it in writing?
Yes.
Okay, so I can ask them to please respond in writing, because again, this is going to go to a specialist who's going to review, who's trained on benefits, right? It's an expert. They're going to review your inquiry and get back to you. But if you want them to respond in writing, I can just document that. Please respond in writing. Or do you prefer that they give you a call?
I would like for them to do both if I can. I know I'm being a pain in the butt. If I'm being a pain in the butt, let me know. I'm just
No, I clearly understand where you come from, right?
Okay.
So certainly to me every question is valid, right?
Okay.
So what I would recommend, because you have more than one question and you never know what may come up once we hang up.
Right.
So I would recommend leave it as have them call you
And then ask
Write
them to
down,
write it.
ask as many questions and write down your questions. So when they do call you, you're prepared.
Okay.
And then after having a conversation with them, ask them to reply and write it.
Are you a union person by any chance?
No, I'm not. I'm just a person that cares too much.
No, you're a
I'm
person, you're a
drained
human being.
at times.
You're a human being, that's all you are. That's what you are. Okay, I got you.
And I like to treat people the way I like to be treated.
Okay, that's cool. That's cool. All right, I appreciate you. Thank you very much. What you say your name was
You,
again?
Jack, you're welcome, sir. I hope I answered all your questions and concerns.
You do.
And I thank you for calling MCA Customer Management.
All right, take care. Well, we got a good one at least.
Yes, smart lady, and very, very compassionate that she cared about your questions.
Yeah. So I don't know how long it's going to take. You see that ticket's been open since December, and then I called them before December. Good. When they call me back, as soon as they call me back, I'll let you know, and then I'm going to ask them to send something in writing.
It depends on their answer, but that should be in writing because you'll have no other proof that they sent this to you.
Right.
And it really should be in an FAQ. They are supposed to tell you that you can opt out or waive. They cannot just force you into this plan without telling you that you have options. That's part of the rules. Can't just force you into the Medicare Advantage plan without not telling you what your options are.
Okay, she wants to go to the park.
Go do what you got to do.
Okay, thank you, Marianne.
All right, honey. Talk to you later.
Talk to you later. All right.
Bye. Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. You just watched a video with myself and Lloyd Archer talking to the BSC. Find out if he would lose his health benefits if he had to waive his MTA healthcare program in order to stay on traditional Medicare. So he did get an answer back from the BSC, and what they said to him was that he could waive his MTA benefits and opted to stay on traditional Medicare. However, if he had a family plan, the family would lose their health benefits as well. So knowing that that might not be something that you all want to engage in, you're basically stuck. And then, of course, the MTA or the TW100 gets the savings either way. They reap the reward of having forced you onto an MA plan that there's little to no cost to the MTA. And if you waive your benefits, that saves them even more. So the only one that has that trouble would be you. So the short answer was, yes, you can waive your MTA benefits to go back to traditional Medicare. You would have to purchase a supplement on the outside marketplace yourself. And if you have a family plan, you would also have to purchase health insurance on the marketplace for your family as well. You can get back into the MTA program during the next open enrollment period. What they did not or could not tell us was by you waiving your MTA benefits, would you lose any union welfare fund benefit? And that answer we're working on right now as well. So we'll get back to you regarding that. But understand something. If you waive your MTA benefits to not stay in this Medicare Advantage plan with Aetna and you want to go back to traditional Medicare, you need to vet that first because you might not be able to get into it depending where you live, how old you are, or what pre-existing conditions you have. If you are in one of 4 states, Maine, Massachusetts, New York, or Connecticut, you have a guaranteed issue right. You are guaranteed to be issued a Medicare supplemental plan, regardless of your age, regardless of time of year, and regardless of pre-existing condition. If you do not live in one of those states, you will find it extremely difficult to impossible to get into depending upon those other circumstances. For example, the premium that the MTA was paying for your CPPO was about $250 a month. However, if you don't live in one of those 4 states, you will find that depending upon your pre-existing conditions and or age, you could be paying upwards of $800 to $1,000 a month for that same exact supplemental plan. So if that is something that you are seriously considering, I strongly urge you to try to find out first what that plan would cost you. And if you're going to require underwriting, you most likely will. And then that's where they're going to look at your age, where you live, what county you're in, your zip code, and your pre-existing conditions. And then that could potentially cost you a fortune. So find that out first before you take that leap. As we get more information, we'll be sure to update this video and let you know. But for right now, that's what Mr. Archer was able to secure in a telephone call as well as in writing. Have a good day.